Hey everybody, it's Dr. Eric Balkavich. We're back for another edition of the Thyroid Answers podcast, and we have another guest today. My guest today is Elizabeth Yarnell. She's a naturopath, and the way I say that is really important, and you'll soon understand why. She has a bit of a history to tell. She's had her own health experiences that kind of led her into this kind of functional medicine, healthcare arena, and is now a person who's dedicated their life to helping people with immune and inflammatory conditions. So, Elizabeth, welcome to the Thyroid Answers podcast. How are you doing today?
I'm great. So happy to be here with you, Dr. Eric.
So we met recently at a conference and kind of hit it off a little bit. And I think what you discuss and talk about is in line with what I talk about on the podcast, what I talk about with my book. So I thought you might be a good guest, but the people listening may or may not know who Elizabeth Yarnell is. So can you give us a little bit of background of who you are, your level of expertise, and why you got into space to begin with?
Yeah. So my story really started in 1999 when I went to sleep one night as usual, and I woke up the next morning blind in my right eye. And it was that sudden and very confusing and scary, obviously, to wake up and have things completely change overnight. And in short order, I was in the eye doctor's office being diagnosed with optic neuritis, or inflammation of the optic nerve, and then shuffled off into an MRI where I received a diagnosis of multiple sclerosis when they found 17 scars on my brain. So that really began my health journey. And at that time, I didn't even know what MS was, but I learned that MS is a degenerative autoimmune inflammatory condition that that affects people in many different ways, but always around the nervous system. So our nerves are contained within myelin sheaths. It's kind of like the cord of your computer that has a plastic sheath around. And if you were to open it up, you would see a bunch of wires on the inside. And that's what a nerve is. A nerve is like a bunch of wires, and the brain sends electrical impulses down through those wires through what we call synapses. And they're encased in a kind of a fatty layer called the myelin sheath. And that keeps, just like with our electrical cord, with the plastic sheathing, it keeps the electricity inside so that it actually makes it from one end of the nerve to the other. Well, what multiple sclerosis does is it damages the myelin sheath. So now, if you think back about those electrical cords, when they're broken, they can have like sparks fly out, and the transmission of electricity from one end to the other is disrupted. And that's what happens in multiple sclerosis. That was when I learned that 80% of MS patients experience significant disability within 10 years of diagnosis. So I was just about to turn 30, and I was looking at maybe being in a wheelchair by the time I was 40, which was really scary. And my doctors told me, they said, well, all you can do, we look at autoimmunity as idiopathic, which means we don't know why it happens and we don't know how to stop it. So we have some drugs. They're very, very toxic. At that time, they were all injectable and really extremely low levels of efficacy. Like, we really should never even approve these things. Like 20% chance of improvement if you take these drugs, which is ridiculously low, especially compared to the chance of side effects. And I had some tremendous side effects that I was experiencing. I started off on the drugs. My father is a neurologist, so he was all about, you got to get on one of these drugs, got to get on one of these drugs. And I was on and off for 5 years, and I had terrible hives all over my body. And by the end, I finally stopped. I was having a seizure every time I injected the drug. And I thought, you know what? My body is telling me pretty strongly that it does not want this drug in my body. And I had already begun to look at ways I could help myself. My doctors basically just told me, with multiple sclerosis, there's nothing you can do. You can just kind of go home and and sit around and wait for your body to give out on you. And I would ask them, well, what about if I change my diet and my lifestyle? And what are there things that I can do to help myself? And they told me there's nothing you can do. You're just going to go downhill like everybody else with MS until you end up completely disabled and then you die, which is incredibly depressing as a prognosis for your life when you're 30 years old.
Mm-hmm.
But it was my then fiance, now my husband of 20 some years, who suggested to me that maybe my diet might have something to do with how my body was functioning. And I had to admit, he probably had a point, because really for the entire decade of my 20s, I lived alone. And the only staple foods I kept in my apartment were Diet Coke, Crystal Light, and gummy bears.
That's a good place to start, right? I think if you had to write a story of how to get unhealthy, that might be the first 3 chapters, right?
Exactly. Exactly. Not a recipe for health at
So when
all.
you were going through this, what was your career at that point? What were you doing?
So I've had many careers and career paths in my life. And at that point, I was a multimedia instructional designer and also a freelance writer. And that night, actually, when I went blind, I had been working on an article for the Denver Post on cross country skiing. And that was one of my clues that something was wrong, because I had been working on this article for weeks and pulled it all together and printed out a draft that I thought was pretty good. But it was late at night, and so I was brushing my teeth and kind of looking over my draft and thought, okay, well, I see 3 spots that I definitely want to change in the morning, but it's late and I'm tired. So I set it aside. And when I woke up in the morning and I set my pages down next to my coffee, I couldn't even read them anymore. It was like a ghost had come in the night and erased entire portions of the text. And what I could figure out, what I could piece together, I couldn't even understand, which was really frightening. In the end, I actually had to turn in that article to my editor at the Denver Post, without whatever edits I had seen before, and knowing in my heart it was not up to my standards.
So at that point, you don't really know anything about functional medicine, nutrition, because I would hope, right? Because if your diet was what it was, and I don't know that it's that different from the vast diet of a lot of people in the US, right? We consume a lot of processed foods. And so I think that's one of the reasons why we see a lot of chronic health issues, obesity, MS, lots of autoimmune conditions. And we'll get into that maybe a bit later. But at some point here, you decide, hey, I'm going to take a different path, right? And so what was the process from going from traditional allopathic medicine? There's not much here to help me. The medications aren't doing what I was hoping they might do, right? Giving me a higher quality of life. You can change your diet, change your nutrition. Your significant other had a big impact in maybe that role, but how does that get to where you are today?
You mean when we were dancing at the pool party?
Yeah. Yeah.
Yes, because if you were to look at me now, I'm 23, 20, yeah, 20, I guess 23 years past diagnosis. You would never know that I have multiple sclerosis. And that has nothing to do with the traditional allopathic medical community, which is where my roots are, right? My father's a neurologist, my mother was a registered nurse and then a clinical psychologist. And so nobody had ever even thought about exploring anything outside of pharmaceutical medicine for health. But what I started to learn was that pharmaceuticals are really not intended for healing. They're intended to suppress symptoms, to mask them. They're palliative. They're intended to give you relief from something that is bothering you, but they're not intended to address whatever it is that's causing that problem to begin with. And in fact, in my experience, my medical team nobody even asked me, what do you eat? Nobody asked me, how is your pooping? Nobody talked about anything about really my health beyond, oh, well, there's this very expensive pharmaceutical drug that costs about $1,000 a month. You better have good insurance, and you're still going to end up, you still have MS, and it's not going to cure your MS or stop it. And in fact, while I was on the drug, I continued to have flare-ups, which we call exacerbations in the world of MS, at a pretty steady pace, even though I had been taking the drug.
So I think for listeners, I want to make sure, even though technically we're talking, this is primarily more functional medicine podcast, it sounds like, okay, well, somebody might listen to this and say, well, you're saying that drugs aren't helpful, they don't help people. I think what we want to do is have a distinction as to what they are to do. And I think you said, hey, they're here to manage signs and symptoms. And somebody might say, well, but they cure high blood pressure, or they cure high cholesterol, or they help with those conditions. And I just want to make sure this isn't an anti-medicine conversation. However, we do need to consider that what those medications are doing is they're treating a condition. They're not curing a condition, they're managing a condition. So when you say, hey, my blood pressure medication works to do what? It works to lower my blood pressure. Well, it's lowering your blood pressure, but there's also trade-offs as a result of doing what you're doing to manage it. Oftentimes when we have high blood pressure, why is blood pressure elevated? Because there's stress on the vascular system. Maybe the brain is not getting enough oxygen, so the body is increasing blood pressure to force oxygen to tissues. And when we take a blood pressure medication, that lowers the pressure, but now we can't perfuse the body the same. So maybe I'm not getting blood flow to my head as quickly as I should. So when I get up, I get dizzy, I lightheaded, I could fall. Maybe I'm not getting blood flow and circulation appropriately to my extremities. So now I develop nerve damage and neuropathies, which are rampant in this country. And so, yes, drugs can address and manage labs. They can manage signs and symptoms. But if they truly actually fix the problem, then you wouldn't need the medication after a period of time, right? And I always tell people, if the blood pressure medication works to fix the cause, right, then why do you need it? Right? It should be fixed. Or why do you need 2 blood pressure medications? Because the first one didn't work well enough. So then we had to add another one. Why? Because the body is pretty smart. It says, hey, if I need to increase blood pressure and you've reduced this pathway, then I'll raise it another pathway. But often what we do, and I'll kind of end with this kind of piece and then let you kind of jump in, is that when we don't know how to fix the cause, or don't know even where to look or desire to look, oftentimes we change the parameter and change the idea of what needs to be treated, right? I get this thing, my head hurts. Oh, that's a migraine. You have a migraine condition, so we're going to treat your migraines. So instead of saying, oh, we need to identify what the migraine is, we've identified the migraine as the thing that's the problem that needs to be suppressed or treated, instead of looking at it as, oh, that's a sign of a condition or a problem. So do you kind of see it along the same lines?
Absolutely. That was so well put, really. Exactly. The way that I look at it and the way that functional medicine looks at it is, we want to find out the root. Like, why is this happening to begin with? We don't want to just suppress it and give you relief. We do want to do that for sure, but we want to stop it from the beginning. We want to figure out what's going wrong underneath that's causing this symptom to turn up. And the way I look at it is that most, if not all, symptoms are due to inflammation. And so if we can figure out what is triggering the inflammation, then, and maybe remove that, just like celiac patients, when they figure out that their issue is gluten or wheat, and they stop eating wheat, and lo and behold, a lot of their symptoms go away. I think that is really kind of, in many ways, the model for why we become inflamed. We have to figure out what the trigger is. And it can be many, many things, but we have to look for them in order to find them.
Yeah, and that becomes a big issue. And I want to dig into that in a few minutes, but I want you to kind of kind of give the listeners, how did we get from chronically ill person to clinician? Did you find somebody that said, okay, here's how we work and help you with MS? Or did you say, listen, I think diet, lifestyle, nutrition may play a role, and I got to find a way to learn how I can change that? And then did that lead you to school and through the process of going to how this kind of naturopathic training? Then you go, oh, okay, I get it. These are the tools I'm going to use to help me heal and repair.
That's absolutely what happened. I had to really discover these things in many ways organically on my own, because I had never even heard of naturopathy or any alternative to our medical system. Really, in 1910, when Andrew Carnegie and J.D. Rockefeller teamed up to demonize anything that wasn't based in pharmaceutical drugs,
yeah,
which came from petroleum, let's be clear, and that was where their interests were not health, but for money. They really managed to do a pretty good job suppressing information about any type of alternative health and making it seem like it was something to be mocked and demonized. So no, I didn't know anything. My doctors didn't know anything. I remember asking my MS doctor at my 10-year appointment even, and saying, well, he's like, you're doing really well. I'm like, yeah, well, I think diet and lifestyle has an effect. And he said, well, yeah, everybody should have a healthy diet, but he didn't really know what that was. And even my father, who's been a neurologist for more than 50 years and is very good at what he does, doesn't believe in nutrition. I mean, oftentimes all of his sustenance for an entire day might be a bag of Hershey's Kisses. So he's kind of famous for that in the hospital where he works. So yeah, I didn't really have any guidance in this. I had to start exploring on my own. I started taking weekend workshops and classes, and that led me to want to learn more. The first thing that I started to do was to try to improve my diet. I was reading books from like the Mayo Clinic and the ADA and trying to figure out what they were all saying was common, not necessarily for multiple sclerosis, but what is a healthy diet? And what I was able to kind of boil everything down to was that whole foods are better than processed foods. And that was a revelation to me at the time. I was a teenager in the 80s. I completely bought into the whole aspartame, no sugar, no carbs, no fat. Actually, it wasn't no carbs then, it was no fat. All of these things I thought were supposed to be better for us, right? Margarine versus butter. I mean, all of these mistaken tropes that were going through society then. And I had a long way to come before recognizing that if I could return to the foods that our bodies evolved on this planet to function with and to utilize for life and for growth and for energy, then that would be a positive thing for my body and help to bring it back to a state of homeostasis.
So you do a bunch of training, you figure out some of this stuff, and then through that process, you figure out how to start working to improve your own health and well-being, right?
Yes. So that was starting, and then I ended up continuing on and deciding to continue on and get a degree as a traditional naturopath, without really knowing what I was going to do with it. My main interest was helping myself, helping my family. My oldest child was really ill from the minute he was born, and I was very, very worried about him. My husband was having weird symptoms of random fainting and vomiting, and I was really worried about him, as well as my own future, looking into a wheelchair at some point. So there was a lot of, I really initially just wanted to help my family get better.
So now you're out, you're helping yourself, you're getting better, you're seeing other people get better with other issues and conditions. And so I think we started to touch on that, which is as you kind of have made this journey over the last couple decades and helping people, what would you say is at the root of chronic health and illness? Do you think that it is like that we have all these different conditions, all these different diseases that all have different roots of origin, or would you say there's some common denominators here?
I 100% believe there are common denominators. I would call myself a disciple of Dr. Alessio Fasano. He's really the father of celiac disease. And he believes his team, after doing thousands of bowel biopsies, they have come up with what they believe are 3 factors that are common to most, if not all, autoimmune conditions. The first is an environment or a genetic predisposition toward being hypersensitive. That just means that maybe in your family tree, when I heard that, I was like, oh, okay, well, my mom has IBS and migraines. My aunt has fibromyalgia. My uncle on my other side has scleroderma. My cousin has Guillain-Barré, all these autoimmune conditions in my family tree. I'm like, okay, well, I can see my family has some hypersensitivity issues, although I have come to believe that that can also be triggered or exacerbated by hidden parasitic infection, which I think we'll talk about in a little bit. But so Dr. Fasano says, the first one he says is a genetic predisposition, which I believe could also be due to parasitics or parasites. The second factor he says is an environmental trigger. So for celiac, which is what his focus in, that environmental trigger is gluten or wheat. And if you take that away from celiac sufferers, they do pretty well as long as they stay away from that environmental trigger. That trigger can be foods, it can be aromas, it can be things that we're breathing, things that we're touching, we're exposed to, anything we're exposed to in the environment. And then the third factor Dr. Fasano believes is common to most, if not all, autoimmune conditions is a leaky gut. So intestinal permeability, if we want to go into medical speak. And that just means chronic inflammation that causes the cells that line the stomach and bowels, which should be very tightly paved together like a bathroom, the tiles on a bathroom floor, because they need to be watertight. But when there's inflammation, they swell, and now there's gaps, and undigested food particles can seep out and trigger off more of an immune response. Not to mention incomplete digestion, which leads to other downstream issues like deficiencies. So I think to kind of wrap that all up, I believe that the commonality with all negative medical conditions is inflammation.
Yeah. Okay. And I agree. I think at the root of what's going on with people's chronic health issues is a low grade level of chronic inflammation, right? Now, what that's caused by, I think, is, as we talked about, there could be various things. It's typically, I think, a load, not a thing. And I think all the systems are tied in together. So as one becomes dysfunctional or stressed, the others often have to adapt and change as well. So I do, and for the listeners, when we're talking about genetics, there are some genetic predispositions that may make you more likely to have to fire off inflammatory mechanisms, to have more likelihood of immune system dysregulation. I even hate to use the term dysregulation, but I'm going to use that term, and have a greater likelihood of potentially developing autoimmune conditions. But I think what you were kind of talking about was we can also have a lot of things that are epigenetic regulators of our genes. So even though I have maybe what we call the wild type genes, which means I don't have any gene that's going to predispose me to chronic inflammation or autoimmunity, other factors can make those genes kind of influence those genes to create some changes in my immune system and inflammatory system, which I think at the end of the day is probably the biggest factor. And the reason I want to just kind of emphasize that is because somebody who has autoimmune disorders, and I have 2 and counting, I don't want people thinking just because I have this genetic predisposition, I'm doomed to autoimmunity and there's not much I can do. What it just means is that you might have a little bit narrower of a window to have a excessive stress load before it actually activates more immune-based damage than somebody who maybe doesn't, but it's not always the case. The way I typically try and explain genetics and epigenetics is using a highway analogy, right? And so if I have the wild type genes, it's like having a 4-lane highway I'm driving on. You could put so much traffic on there, and lots of traffic can flow on there. And typically, if we said I've got a 4-lane highway or a 2-lane highway to get these 100 miles, which one would you take? Most of us would say, hey, I'll take the 4-lane highway because I can cruise down that thing faster. Because if I put 10 cars on the 4-lane highway, it's probably not going to be noticeable. But if I put 10 cars on the 1-lane highway, it's probably going to slug the road down a little bit. And so that would be the difference, right?
I like that definition. What I like to think about it too is to remind myself that epigenetics, we might have the genes, but genes can be turned on or off depending on our lifestyle. So just because you might have a certain gene or a genetic tendency doesn't mean it's going to manifest and show up. That depends on your lifestyle. And if you're going to have a lifestyle of Diet Coke, Crystal Light, and gummy bears, you might have a higher tendency to trigger that gene on. But I also believe, I like to use the analogy of a bucket, that our immune system is like a bucket. We each have a tolerance threshold. And into that bucket, into our immune system, goes all the insults and assaults of our daily lives, whether that's not enough sleep or high stress or alcohol or pharmaceuticals or over-the-counter pain relievers or toxins in our foods or parasites. All these things go into that immune system bucket, and that's where they get processed and then pushed out of the body. But when that bucket becomes too full and starts to overflow, that's when we tip over into autoimmunity and chronic inflammation, which is the definition of autoimmunity. So we have to work really hard to lower the level of that bucket. And we do that by cleaning up our diet, by cleaning up our lifestyle, by cleaning up what we're exposed to. And in fact, I did a TEDx talk about this in 2014 called Poisons in Our Everyday Foods, where I talked a little bit about all of the toxins and chemicals that our bodies are exposed to now that never were there 200 years ago. I mean, really, so much of autoimmunity began after the Industrial Revolution. And I think that has a big effect on how our bodies are functioning. The Environmental Working Group did a study a couple years ago where they tested the cord blood of newborn, brand new babies as soon as they were born into this world. And they found the average newborn already contained more than 200 chemicals in their cord blood. So in many ways, the deck is stacked against us to begin with. We have to be very aware and try to lower those levels of toxins and chemicals in our bodies with our own awareness.
Yeah, I would agree with that. And for the listeners who've followed me and listened to the podcast multiple times, I'm pretty much always talk about the cell danger response, right? So we have a whole bunch of cells. They're typically work in one of two operating modes, a manufacturing mode and a cell defense mode. And when we get blasted by lots of stressors on the system, that if it's excessive, then it can trigger this cell danger physiology that upregulates the immune system. And now the immune system is out there releasing all these inflammatory molecules, trying to find, kill, and get rid of whatever it is. And so if we have a short-term stressor, we have an immune response, we deal with the threat and it's gone. If we have an extended stressor, an extended excessive stressor, then maybe the immune system stays upregulated and continues to kind of break things apart, create more inflammation, create more damage in an effort not to try and hurt you, but in an effort to try and deal with the threat. Often that kind of inflammatory damage creates tissue damage that results in antibodies. We often blame the antibodies, and sometimes I think the antibodies are part of the direct response, but that's only one of the hypotheses. I think another thing we have to consider is the damage to those tissues that occur in these chronic inflammatory conditions is the result of the immune system and not necessarily the antibodies. And we see that in hypothyroidism, where when I was going through training, we were told that the antibodies were like little Pac-Men eating away the thyroid gland. And now we know that that's not really the case. The thyroglobulin antibodies cause no damage to the thyroid gland, and the TPO antibodies cause very little. It's the immune cells that are creating the damage. And oftentimes, again, not by mistake, but because they're being directed there by signals, by cells in danger that are releasing chemicals. So we've got that piece done. Let's talk. We got people with chronic inflammation. As a result, we're both probably under the same idea or concept that the inflammation is probably more of an adaptive, protective response than it is, hey, the immune system woke up one day and just decided it was going to attack your myelin for no apparent reason. Is that fair?
That is absolutely, yes, I agree 100%. There should be no mystery as to why the immune system is overactive in some people, because we just have to look and find the triggers. The immune system doesn't want to just be overactive. And in fact, the whole word autoimmunity I have a problem with, because if we take it apart, auto means self, immunity means allergic. Allergic to self, evolution would say, nay, that's not possible. You cannot be allergic to yourself. So instead of giving up and saying, well, I guess you just have an overactive immune system and we don't know why, I think that there's always a trigger. Why is the immune system being so overactive? Well, there's something there that we're not looking for. And that's triggering it, because that's what happens when the immune system is triggered, is it sends out that whole inflammatory cascade. And I totally agree. It's the immune cells that cause the damage, but they're fine if they're not being triggered.
Right. And so that it brings up two big questions, right? And one of them would be, well, I've got immune issues. Nobody's told me I have a chronic inflammatory condition. Why do we have all these people walking around with hypothyroidism, diabetes, neuropathies, autoimmune conditions, and why do you think nobody's being told that they have an inflammatory condition? I think the answer is pretty easy, but I'm going to see what your thoughts are on that.
I agree. Even obesity is now being considered an excessive inflammation in the body, not just a calories in versus calories out formula that we've always been taught. Why aren't we talking more about inflammation? I've been shouting inflammation for 15 years and really recognize that people do not self-identify as inflamed. So I like to say, okay, well, let's look at this. Inflammation in the head, we could call that a migraine. We could call that a headache. We could call that brain fog. We could call that anxiety. We could call that depression. All of those are inflammation-based. Inflammation in the sinuses, we could call that runny or stuffy nose or chronic sinus infections, or even postnasal drip, always clearing your throat. Inflammation in the chest, we could call asthma, we could call high blood pressure, we could call heart issues. Inflammation in the gut, we could call bloating, we could call it acid reflux, we could call it cramping. Inflammation in the bowels, we could call diarrhea, constipation, or going between both of them. Inflammation in the joints, we could call fibromyalgia or arthritis. Of course, anything that ends in itis is medical terminology for inflamed, like when I had optic neuritis, inflammation of my optic nerve. So yes, we're not talking about the word inflammation, and helping people to recognize that if they have a symptom, it's probably due to inflammation. And even though their disease might have a name, there's probably inflammation at the root of it.
Yeah. And I think I say all the time, what gets measured gets managed, right? So even though your medical physician who's often running tests, at least initially, might think you have an inflammatory condition, they're often never running inflammatory tests. So if you don't measure it, then you can't manage it. And oftentimes, therefore, it doesn't exist. And if we're fair to allopathic medicine, I think most physicians realize what they're dealing with is chronic inflammation, but their treatment strategy is not to, you can't put everybody on corticosteroids, right? That's not going to work. We've seen that experiment go wrong too many times. So what do? We just realize we have an inflammatory condition, and I have a drug that will treat or manage the condition that's caused by that inflammatory mechanism. And I don't have the time to focus on the cause of what caused it, because that could take a lot of work, could take a lot of time, and I've got a limited time on my visit. So my job as the physician is to identify the disease or the pathology and provide a strategy to manage it. So measuring and looking for inflammation is also, I think, a really important strategy, because if we know where we are, then we can also manage improvement using those same markers. So can you talk about, just from a general blood chemistry standpoint, somebody's like, well, what tests should I look at maybe on a blood chemistry panel that's going to help me know I've got a problem with inflammation? Are there even inflammation markers on a regular blood panel?
So that's probably a better question for you than for me, because I am more in line with functional medicine, where I value the patient experience and the anecdotes that they tell me. So for me, I look at my assessment is less based on laboratory results. Some of it is, some of what I do is based on laboratory results, but more, well, what are you feeling? How is your body responding? How is your life? How are your bowels? Are you pooping every day? And if they tell me, well, no, my normals, I only poop once a week. Well, wow, that is huge inflammation in your bowels that we can tell just from that question. So I don't know if that answered what you were asking me.
Yeah. So I'll answer that question. If you've got a lab panel done and you want to know, is there any inflammatory tests on there? There are a number of inflammatory tests that can be run just generally on a blood chemistry panel. We can start with an elevated uric acid, often a sign of increased inflammation. We could look at a low bilirubin level as an indicator of oxidative stress, potentially. We could look at high sensitivity CRP, regular CRP. We could look at elevation or low levels of homocysteine. We could look at elevated levels of fibrinogen. We could look at changes in our white blood cell count as potential indicators of inflammation in the system. We could look at elevated ferritin, and especially we could look at an iron dysregulation pattern. I often talk about like 7 or 8 or 10 tissue patterns of chronic inflammation in the body. But just generally, if you wanted to know and you weren't seeing a functional medicine practitioner, something like a high sensitivity CRP, almost every medical physician knows what that test is. And it should be, especially if you have any chronic health issues, it should be a test that they can run with, even with your insurance covering it. But there are lots of tests. If we just look at a general blood chemistry panel, where we can start to say, okay, we've got an inflammatory process going on. If you've got thyroiditis, if you've got thyroid antibodies, if you've got elevated reverse T3, lower levels of T3, you've probably got an inflammatory process going on. And then it involves, somebody has to dig in and say, okay, why is this occurring? The allopathic response would typically be, let me give you something that's anti-inflammatory and manage the other signs and symptoms. From a functional medicine approach, we need to dig in and ask why. So that's what I'm going to do now, is ask you, what are we doing to assess, or from your perspective, because our processes may be a little bit different, but from your perspective, you've got somebody who's coming in, they've got chronic health issues going on, chronic signs and symptoms, maybe a number of named conditions, which you may be much like me, like, I don't care what the name of this thing is. I'm looking at you. What are your signs and symptoms? What's your health history? What's your health timeline? But where do you start with a client to try and uncover what's triggering or causing this inflammatory response?
So my process is pretty standard at this point, because I have figured out what really works. And what I do when a client comes to me is we first start with an extensive health history, where we look and we identify all of those inflammatory things that are going on. In fact, I have an inflammation quiz that people are welcome to access. It's at inflammationinvestigator.com. And you go through it, something like 75 questions, so stick with it. And you might be surprised at some of the questions and be like, wow, I didn't even realize that was a sign of inflammation. So that can help determine how much inflammation is in your body. But then we start off, and the centerpiece of what I do is a customized anti-inflammatory diet. And I do this very, very specifically based on a test called the mediator release test, the MRT, which I believe is the gold standard of food sensitivity testing. Again, it does not look at antibodies, which we've already kind of agreed are not really the symptoms or the causes of inflammation. Instead, it looks at mediator release. So mediators, the most famous mediator we all know is histamine. We know that if we have, say, a bee sting or a poison ivy encounter, and we take an antihistamine like Benadryl, that we can get some relief from the discomfort that's being caused by the swelling from that encounter. But histamine is only one of 80 or more mediators that the white blood cells can release upon exposure to what they deem to be a threat. So this test assesses the levels of mediator release with 170 foods and chemicals based on your bloodstream. And it's very, very accurate and allows me to design a very customized dietary roadmap plan of not what you shouldn't be eating so much. So instead of saying, oh, we got the test results, A, B, and C turned up high, just avoid those and do an elimination and you should be fine. Instead of that, we look at the X, Y, and Z, the foods that were not inflammatory for you, because of course you still have to eat and we don't want you to be deprived and we want you to be healthy. So we focus and create a diet based on those foods that we know for sure are not inflammatory for you. It's amazingly, within 2 weeks, people have incredible improvement. So that's a centerpiece. I also address digestion. To do this, I do another test, a 24-hour urine collection. Shows me, are you having problems digesting carbs or proteins or sugars, or maybe your electrolytes are out of whack, or maybe you're deficient in vitamin C because that's a water-soluble mineral. So there's, or vitamin, sorry. So there's all sorts of things that we can see through the urine that we can't see through the blood. And when we do them together, it gives us a very holistic view of the body and allows us to tailor this therapy. And then the third part is an herbal parasite protocol, because the longer I'm in practice, the more and more I'm convinced that hidden parasitic infection is at the root of so many people's chronic inflammatory issues.
So how do you go about determining that that's the cause? Is there some type of test that you're doing?
I wish there were really good, reliable parasite tests, but parasite testing is notorious for false negatives. So instead of having someone spend the money and the time and do a stool test, or which is the typical way to test for parasites, unfortunately, not all parasites come out through our stool. Some parasites live in our liver, some parasites live in our heart, some live in our bloodstream, some live in our brain. Some come out through our skin, not through our bowels. So a stool test is not the be all end all for determining parasites. And the last thing I want to have happen is for someone to get a negative test result and say, oh, I'm going to move on. I already knocked that one out. There are no parasites. I have a pretty good intuition about people when I talk to them, and there's a number of questions I ask, like, when did this all start? Sometimes people can track it back to sudden onset. Oh, I went to Thailand and I got sick, and you know what? I've really never been the same since. Or you don't even have to have had foreign travel. I had a 24-hour stomach flu, or I got food poisoning. And sometimes just even me mentioning these things will trigger a memory, and like, oh, I went there and I had that terrible stomach issue, terrible food poisoning, or whatever I called it. And then I recovered, but really, I kind of haven't been the same since then. So I will use sometimes those kinds of things to help assess. But in general, the herbal parasite protocol that I work with is very, very gentle. It's a 30-day protocol. It contains 4 different herbs. One addresses full-grown parasites, one addresses the larvae, the third addresses eggs. Some parasites lay 2,000 eggs a day, and the fourth is specifically a vermicide. And so you saturate your tissues with these. It's very well tolerated. but it's completely within someone's own control. And if they don't feel good while they're doing it, they can stop at any time. But it does a pretty good job of clearing out parasites, unless there are some that are more stubborn and we have to go on to another round and maybe some other ingredients. But in general, this is the best across the board parasite protocol that I have found.
So based on history, clinical experience, and some symptoms, and just a default that you think most people have them, you're putting people on a parasite protocol if it's appropriate.
So we know that, or if we're talking about and accept that the immune system is being triggered, and the immune system is triggered when it sees, because the immune system is always kind of scouting out through the body and saying, is there any foreign invaders that I need to address? And it was developed because most foreign invaders were bacteria or parasites. And we do a pretty good job with our immune system of handling those. We create antibodies for bacteria, and then for viruses, we have heat and inflammation that can deal with them. But parasites don't care about any of those things. And so the immune system says, wait, there's a foreign invader. We need to sound the alarm and start the immune cascade. And so it triggers off the inflammatory response. But the parasites are like, doesn't matter, they don't even notice. And then you end up in this vicious cycle where the immune system says, wait, there's still foreign invaders. Oh, I thought we got them. No, wait, there's still foreign invaders. And so you end up with chronic inflammation because the parasites are going to be there until you address them directly.
Okay. So beyond parasites, what are the other potential stressors that you see in your practice in years of experience that are often driving chronic immune inflammatory processes?
I think diet has a lot to do with it. If you are ingesting all of these, what we call faux foods that are filled with chemicals and artificial colors and artificial flavors and preservatives and faux things, pretty much anything that says light or diet or low cal, you should run away from because they've added something in there to make up for whatever they're doing. I think all of those things add to the level in our toxic threshold buckets. And our bodies were not designed to process ingredients that come from 2 miles underneath the surface of the earth. And if we stick back to my motto, which is whole foods are better than processed foods, we can avoid a lot of those really toxic ingredients.
Okay. So we're down to parasites as a primary, food as a primary. Any other common denominators that you see with chronic immune and chronic inflammatory conditions?
Well, back to Dr. Fasano, when there is chronic inflammation in the body, his team discovered there's always damage to the digestive tract. And we know that 80% or more of our immunity is based in our digestive tract. So when there is damage and we are unable to have complete digestion and we're having leaky gut and all sorts of other issues that are associated with that, I think that is the third factor.
Okay. So what if for somebody who's saying, do I have a leaky gut? Do I not have a leaky gut? Are you testing it, or are you just kind of going again by clinical feel?
I just assume that because of Dr. Fasano's work, I don't need to cut people open and look or do scopes because he did it. I make that assumption. If you have had chronic inflammation, we know there's damage to your digestive tract. Okay.
And so is there from a restoration of immune, autoimmune, chronic inflammatory conditions, if we had to give somebody kind of a roadmap of things that they could start to do to start to improve their health and well-being, what would be some of those key strategies that we could have them start with from your perspective,
so,
even before they see you, right?
Absolutely. The first thing that they can do is they can start reading labels on their foods. And if there's words you can't pronounce on a label, you probably shouldn't be eating it. Try to stick with foods that you recognize as real. So That's, again, back to my motto, whole foods are better than processed foods. If you can recognize it as a food, your body will be able to process it better. Now, healing only happens in the absence of inflammation. So removing the inflammation is key, and you can start to remove a lot of that by starting to avoid things like artificial sweeteners, artificial colors, artificial flavors. And in fact, I have a handout at multiplesclerosisdiet.com that you can pick up, and it'll give you the top 3 items that I think everyone with MS or other autoimmune chronic inflammatory conditions should avoid like the plague.
Okay. So you also, in the beginning, we talked about toxicity, and we have this toxic burden that we're under. Where do environmental toxins play into your thought process of why somebody's having chronic health immune issues to begin with? I mean, is it possible that the toxins that they're exposed to that maybe aren't coming from unhealthy foods is potentially creating some of their problems?
Absolutely. So if you live in a city, every time you walk out your door, you are breathing in particulates in the air from our traffic and our industry, all of those things. Every time you go into a salon and polish your nails, those are toxins that you're breathing in that they have now linked with cancers for those salon workers who are breathing them all the time. So some things that you can do on your own, you can choose to purify your air in your house. So in case you have carpets or paints that are off-gassing, you can pick those up. I love running our air purifiers all the time in our house. I also am a big believer, leave your shoes at the door. Don't track in all this crap that you're picking up as you walk around your world into your house. Keep your home environment clean and freer of a lot of those nasty things that we can just pick up. I mean, even just from a sidewalk, things like that. So yes, some people have mold issues in their house. That deserves to be investigated. Those can cause big issues, and you might not even realize. But if you live in a wet, mold-prone area, or you have things that haven't been fixed in your living, or maybe you work in a building that is full of toxic issues, even through just since the pandemic, there's been some issues of bacteria and things in the water supplies because a lot of buildings sat without toilets flushing for a year, pretty much, and things built up. So it could be in your workplace, it could be in your home environment. Those are all things that deserve investigation.
So because a lot of what you're dealing with, it kind of centers around the immune system and the GI tract. How for the listener who's going, I'm bombarded by toxins, they're everywhere. How are toxins themselves, how are they initiating this upregulation in the immune system? I often hear people say, but everybody's exposed to these toxins. That person doesn't seem to have immune or inflammatory issues. I do. How is that toxin triggering a problem for my immune system? Can you explain that?
I'll try. So everybody is different, and some people have more tolerance, higher tolerance levels for some things, but it also depends on your environment. Maybe you have parasites and somebody else doesn't have parasites, so they have more space inside their body to process things. But yes, and so I see that all the time with things like air fresheners. Oh, those things are terrible. Dryer sheets. Like we forget that aromas are molecules too, and when we breathe in these things, we're breathing those molecules in. I can't stand those commercials where they're like, oh, my laundry smells so fresh. Well, you're just bringing all of these molecules, these toxic molecules, chemicals, down deep into your lungs where they can maybe get caught up and cause irritation problems. So you can't ever compare yourself against somebody else. Somebody else might have different stressors or different processes inside their body, or have a lower tolerance threshold in their, or lower tolerance build up in their own tolerance bucket. So you have to just watch out for yourself. You might be more sensitive. And I believe once you have been diagnosed with an autoimmune or chronic inflammatory condition, you will always be more hypersensitive than maybe other people. And so you just need to be more aware about what you're exposing yourself to.
Okay. Let's talk about lifestyle and how that plays a role. So we've got emotional stress, we've got respiration, we've got sleep. How do those things play a role in triggering chronic inflammatory conditions from your model?
I think that those things feed into it, but I don't think that you can instigate, I don't think you can create a condition out of stress. I think stress makes things worse. And certainly, like, for instance, if I were to have irritable bowel syndrome, and my doctor might say, oh, well, it's stress, you're too stressed out, that's what's causing your irritable bowel syndrome. Well, I think there's probably other triggers to that, but it makes you more stressed, and then it becomes a vicious cycle in that too. Because of course, if you're always frantically looking for a bathroom because you're going to have explosive diarrhea spontaneously, that is very stressful. So I think it kind of plays a role, but I don't think that stress creates.
So I would argue that point with you, because I think
go for it.
emotional stress could absolutely change your physiology and your chemistry that drives an inflammatory response. If you're living in a position of extreme emotional stress, right, then what does that do to the sympathetic nervous system? It's going to upregulate your sympathetic nervous system. It's going to downregulate your parasympathetic nervous system. It's going to upregulate the inflammatory signals because the body's perceiving a threat or damage. So I think for sure the emotional piece, absolutely. And I think there's enough literature to show that that emotional stress can change our gut flora. It can change the inflammation that's going on in the GI tract. When you change the gut flora, you can potentially change the production of things like short chain fatty acids that maintain the tight junctions of your GI tract, that regulate the immune system. And 70%, as we said, is surrounded around the GI tract. So I think it can. I think what we have to be careful with is just say, oh, you're just stressed out, and that's why you have it. Yes, but if I do feel excessive levels of stress, whether it's from a bug, a toxin, an organism, a disrupted sleep pattern, or thought process, for sure, it changes our physiology and chemistry. And the easiest way to explain that to somebody is we'll go back to your let's go back to your TED Talk episode. I don't know if you enjoy speaking in front of a large group or not, but there are a lot of people who do not. And when people are almost forced to go speak in front of a group, especially a large group, they often do one of the 5 or 6 P's, right? They may pass out, they may puke, they may have to pee, they may have to poop, they may have to perspire, right? And all of those are thoughts changing the chemistry. If it's short term, it's maybe not a big deal, but if it's long term and we're living in this kind of upregulated stress response, the cellular system still may perceive danger, whether it's toxin or thought. And I think the literature is pretty clear on that. So I think it
totally
could.
agree with you there. But I do think that if you look at those people who are in those chronic high stress lives, that you can see that there's other things that are falling by the wayside too, right? Maybe they're not eating well because they're so stressed. There might be other environmental factors that are going into that. So yes, I think it all goes along together, but I don't know if you could say, oh, I'm going to take a normal, healthy person and put them into a job which requires them to uncomfortably speak in public all the time, and that's going to cause them to have an immune or a autoimmune condition. Maybe.
Well, listen, we can agree to disagree on this topic, but I could use the same analogy when it comes to the foods, right? There are plenty of people who, just because they have a bad meal one day, don't wind up having parasites and a leaky gut, right? So
True.
it is chronic stress. So I think the most important thing is none of these things happen in a vacuum. If I
Yes.
have an acute stress response, my body is adaptable to acute stress responses. And so some stress in our life is hormetic. There's a benefit to having stress because it actually, if we can have the stress response, if it's not excessive, the body deals with that stress and comes out from that actually stronger than we were before. However, if stress is chronic and consistent and there's no recovery, that's when we get into our excessive stress response, which triggers this chronic immune inflammatory process. My thought process may be a little bit different from you, but I think we have
So
to
are you
consider that
saying
it's a
that you
load,
think,
not a thing.
yes, I agree there's a load. Do you think that stress can be the etiology for say thyroid dysregulation?
Emotional stress? Any stress could be the etiology for it. Could it be
Right.
toxin? Sure, it could. Could it be emotional stress? Absolutely. We see a lot of people who they were cruising along, they seem to be pretty well, and now they have a traumatic incident that happens, emotional stressor, divorce, and guess what happens over the next 6 months is they now develop this autoimmune condition. Well, what was the trigger? Well, that excessive emotional stress response was probably a major trigger in what's causing the issue. So it would be nice if we could just take the brain and the emotions out of it, but unfortunately, I don't think we can. But to your point, does that emotional experience change their sleep patterns? For sure. Does that emotional experience change their dietary patterns? For sure, right? Does all of these things play a role? Does the way somebody eats change their gut chemistry that then changes their neurotransmitters? Absolutely. So I think when we look at it like a thing, that's what gets us in trouble, because
Yes.
everybody then says, oh, okay, so EBV is the cause of autoimmunity. EBV is the cause of thyroiditis. Well, maybe, and maybe not, right? Are parasites the cause of everybody's immune issue? Maybe, maybe not, right? But it's usually not the thing. And I think that's where we get ourselves in trouble, because we're doing almost the same whack-a-mole medicine approach by saying it's got to be this, it's got to be that. And I think the better way to look at it is, what's the load I've put onto this system? Most people can adapt to a certain amount of stress, but if it's too much for an extended period of time, that shifts us into danger physiology, in my opinion. And if we have excessive amounts of an excessive load all at one time, an acute load, that too can push us into danger physiology. So we have to be aware of both of those things, which is why I really like seeing somebody's health history, their health timeline, looking at their signs and symptoms along with their chemistry, because we want to try and identify, how did we get here? And many times we can see that as we look at their health timeline. We can look, okay, here's a problem. Here's antibiotics. Here's infection. Here's another treatment. Here's a lot of family and emotional stress going on. Here's dietary issues. Here's all these things. And so how did we get to this person who's got an autoimmune condition? Well, look at the last 20 years of their life. That is a developing train wreck, right? And so how do we fix it? It's not a one thing process. It's going back and saying, how do I start to remove the current stressors that are present, that I can reduce the load or eliminate those stressors? But many times we're just trying to reduce the load to a point that danger physiology starts to go away. And now the tissues can be in a more recovery mode. My opinion, maybe not yours.
I love that perspective. Yes, I agree. And certainly that's why we talk about that a whole health journey, right? There's a lot of different steps and a lot of different approaches that you might bring in, or one person might bring in to their own health journey, not just 1, 2, 3, 4. It's not a straight line. It might include yoga, meditation, different things to try to reduce those stress levels, along with concrete actions like changing your diet or maybe addressing parasites. I agree. I think that all of those things go into it. There's not just one factor or one condition or one underlying issue that is the same for everybody.
Agreed. All right. I think that's a good place to start wrapping this one up. So let's do this. If somebody wants to learn more about Elizabeth Yarnell, where can they find out more about you? Obviously, we talked about you have a TED Talk that's out there on the interwebs, so they can go search for your TED Talk. But where else can they learn more about you and what you do?
The best way to do it is to go to my website, elizabethyarnell.com. And from there, it's kind of the center of my ecosystem. You can get a lot of different places from there.
Awesome. Books, podcasts, any of those things?
So I have a cookbook you can see kind of behind me on the shelf there. It's called Glorious One Pot Meals. And it is a quick, easy, and healthy approach to Dutch oven cooking if you're looking to focus more on whole foods rather than processed foods. And that is easy to find. It's been out for a long time. And then I actually have a book coming out in March for MS Awareness Month about redefining MS and looking for triggers in places we haven't been looking before.
Okay. Awesome. Well, I appreciate you coming on the Thyroid Answers podcast. It was a good discussion. We didn't necessarily, maybe we were close, so I think agreeing on stuff, but that's the reason I like to have a longer conversation with somebody, is because I don't think we should all agree on everything. Okay. I think we all have ideas and opinions, and this is how, if we're open enough, we can start to have conversations where we have differing views. We can have a conversations. It can be civil. We don't have to shut somebody off or shut somebody down and say, I think you're wrong. We all talk from our own ignorance and bias, right? And so when something works for me, we have an ignorance and bias. When I read certain things, that creates my ignorance and bias, right? That's what happens in allopathic medicine. It happens in functional medicine as well. And
and this is how we learn, right? We learn by talking with other people and learning about other people's experiences and what they have found that works.
Yeah. So I think these are the types of discussions that are beneficial for the listeners. They're beneficial for clinicians to hear maybe something that's a similar opinion, but maybe coming from a different angle. And then it makes us take a step back and think. At least if we're humble, it gives us a chance to take a step back and think, maybe I haven't considered that. Maybe I need to check it out. But I appreciate you coming on the podcast. Maybe we'll do this again in the future and have another discussion. Maybe after your book comes out, that's probably another good time to have a continued discussion on the book and what the new perspective might be on MS. So once again, thanks so much for coming on the podcast.
Hey, thank you. Such a pleasure.
All right. Take care, everybody, and make sure you listen to this one and share it with your friends and family. Take care.